Okay. Good evening. My name is Mbeke Ekanem. I am a current Charles R. Drew postgraduate, and I'm here today to present research um, from our research team. The research I will be presenting is called a descriptive assessment of COVID-19 testing site volunteers. The background of our research is based on the great disparity in access to testing in the Los Angeles County region. This initiative was started back in April of 8th, 2020, with the help of Charles R. Drew University of Medicine and Science, as well as the LA County Supervisor Mark Ridley Thomas, in collaboration with the LA County Fire Department, the LA County Department of Health and Science, to help provide testing to the South Los Angeles regions, specifically the communities of Watts, Willowbrook, and Compton, as well as individuals at CDU. The reason why this testing is so important is because these areas are under-resourced and over-impacted by the highest rates of COVID-19 cases. The purpose of this review is to understand the value added by pre-professional and pre-licensure health science students in responding to the pandemic. We hypothesize that we will be able to observe a wide variant in affiliated healthcare volunteers and linguistic diversity of our volunteers as well. The methods used for our research were as follows. First off, the volunteers were recruited through various outlets, such as flyers, websites, and our school newsletter. In addition to that, we had word of mouth and social media platforms such as Facebook, Instagram, and third-party applications as well to spread the word. Email confirmations were then sent out to volunteers who did sign up, and volunteers were then providing their availability to come and provide assistance at the testing site. The data was then collected from the surveys via a third-party affiliated website called Sign Up Genius. Now, through our efforts, over 74,000 people were tested for COVID-19, and the characteristic of our testing volunteers are as follows. First off, those affiliated volunteers with the institution was about 47%, specifically 262 people. Those were not associated with CDU were 53%, specifically 299 people. Going into the details of each individual group, those who were a part of CDU, the largest group of that subgroup is ELM, which is a large nursing program based for CDU professionals. Next largest group was the medical students associated with CDU. And last, second and third and fourth largest groups were the RN to BSN student program, as well as the undergraduate student as well. Going into more of our results, we also see that the largest affiliated organization in the non-group of CDU affiliated volunteers was East Los Angeles Community College with 31 students, or so 31 volunteers, and West Coast University with 29 volunteers. Then UCLA with 17 and EMTs with 12. Going into languages spoken, we have the largest group by far, which was Spanish with over 149 volunteers. Then you have the Vietnamese language, Tagalog, Korean, and Chinese as our top four. The total accumulated hours, number of hours by all of the volunteers over this last year was 38,576 hours, and the mean hours per volunteer was 58 hours. Now, based off of the conclusion of the number of hours dedicated by our volunteers, we're able to see that there is value in organized volunteering in regards to healthcare, and providing and having access to diverse health professionals, linguistic diversity, and geographic proximity helps provide the greatest effect to the local community. And we are still currently, as an institution, testing and testing and doing vaccination services to the community. Thank you for your time and for this presentation. If you have any questions, please feel free to reach out to me at Mbeke, Ekanem at cggu.edu. Thank you.